So what we're going to talk about today is called the Glasgow Coma scale, which is a classification scale that we use to talk about traumatic head injuries in medicine. So when a patient comes into the trauma bay, one of the first things we need to figure out is how they're mentating. And the GCS, or the Glasgow Coma scale, should be thought of almost as a vital sign. We check a patient's lung sounds to make sure they have bilateral lung sounds when they come in. We measure their pulses to make sure they have pulses in all four extremities. And with that, we should also be getting a GCS. And this GCS scale, or Glasgow Coma scale, it allows us to talk objectively about our findings so that we know how bad someone's head injury is. And that way I'm not yelling across the trauma bay saying, "It's really bad, guys," and the people on the other end of the room are perhaps thinking it's worse than it is, or maybe better than it is, because using subjective words in a trauma bay does not help, does not get anyone anywhere. So the GCS of a patient breaks down into three different point systems, and the first one is how great or not great their motor response is. And they can get up to 6 points for their motor response. I always remember there are 6 points you can get for motor response, like a V6 engine. Engines move, motor response, V6 engine, 6 points. So you get 6 points if you're obeying commands. You only get 5 points if you are localizing the pain. So say I sternal rub you, but I asked you to wiggle your toes, you didn't wiggle your toes, but I sternal rub you and you smack my hand away. You get 5 points for that. You only get 4 points if you're flexing to withdraw from pain, but you're not quite localizing. And then 3 points if you're demonstrating decorticate posturing, 2 points for decerebrate posturing, and 1 point if you're not responding at all. And if you don't know what decorticate or decerebrate posturing is, I would definitely recommend looking that up. There's pictures all over the internet, and it's something, once you've seen it, you will recognize it for the rest of your life, both of them, because they're just very unusual ways for a person to posture. You can get 4 points, moving on, for what you're doing with your eyeballs. If you're opening your eyes spontaneously, you get that full 4 points. If you're only opening your eyes to verbal commands, you get 3, 2 if it's to pain. So again, if I pinch your finger, pinch your trap, sternal rub you, and then you open your eyes, you only get 2 points. And then 1 if you're not opening your eyes at all. And I always remember you can get 4 points for eye opening, because sometimes when we're mean, we call people 4 eyes, 4 points for eye opening. And then the last category is verbal response, and with verbal response you can get up to 5 points. I remember this because of the Jackson 5. They sang verbally, so verbal response, 5 points, Jackson 5. You get 5 points if you're oriented. You can converse with me and maybe tell me where you are, what's happening, who the president is. If you're disoriented or confused, but you're still conversing, then you get 4 points. You get 3 points if you're using inappropriate words, 2 if you're just making incomprehensible sounds, and then 1 if there's no verbal response whatsoever. And then lastly, if someone comes in and they're intubated, we skip over this verbal response section and we just say whatever the score is. So say someone came in and they had no response to anything, no motor response, and they were not opening their eyes, that patient would then be a 2T, meaning that their verbal response was that they're tubed, 2T.